at a more difficult time. I think we are in New York City, we're a bit more relaxed today, thank God, in New York.
Really?
But those of you who have not heard the authority, and we're talking to an authority here, a distinguished professor at Rockefeller University, clinical investigations, and also you chair the committee on education and training, very much sought on medical boards and also companies dealing, being a board member of many distinguished pharmaceutical companies. So we're delighted to have you and your beloved husband, Ellie, as gifted members of Parkey Synagogue.
We're delighted to be members, Rabbi.
And now that I gave you an official title, you have an additional title. You are now a very respected, welcome member of the medical advisory group of Parkey Synagogue, and very much your counsel very much needed. So, since you are really a specialist in terms of clinical trials, we hear a lot about, so many vaccines are being developed, but one passes the first trial, second trial, third trial. Can you clarify for us, what is a clinical trial?
Certainly, Rabbi. So a set of clinical trials is what is undertaken by a sponsor, which is a term of art for the person who holds the IND. And that is the application to the FDA for approval or registration of a new drug or vaccine, a new medicine. And the way things work in this country and in Europe is first a whole bunch of work is done in the lab. And that may involve animal testing and all kinds of studies of human cells. And that's called preclinical work. And then when the clinical trials, as you asked, begin, they can only begin with permission of the FDA, the Food and Drug Administration, and permission of a local IRB, which I chair our IRB at the Rockefeller, and that's an ethics review. And the first stage of the set or the suite of clinical trials that's required for registration. So there are phase 1, phase 2, and phase 3 for registration. And then phase 4, which is the monitoring of the vaccine or drug after it's licensed and marketed, or called post-marketing surveillance. So phase 1, always the first phase is safety, and safety alone. And they're often, and as the trials progress, they get larger in size. So phase 1 trials are typically quite small, 12 to say 36 people. And the drug or vaccine in this case is tested for safety. And typically they have what's called a dose escalation structure. And that means you start at a tiny, tiny dose. So the dose that is unlikely to do any harm, even if the needed dose might. So you start at a low dose and then you see if it's tolerated and safe and everybody does fine. And then you go to the next dose, and then typically a third dose. There are typically 3 doses in a phase 1 trial. And then when those 3 doses, people have gotten the drug or the vaccine, they've been followed. And this is part of the reason it takes time and you can't rush it. People have to be followed for a certain amount of time. And for a vaccine particularly, because they have to make an immune response, it has to be months. Then and only then can you move to a phase 2. And a phase 2 for a drug finds the dose, and for a vaccine defines the immune response. And those are typically larger trials and involve many more people, and perhaps more people across more age ranges. A phase 3 trial is an efficacy trial. If you think about when the polio vaccine was made available, it was a huge trial of many school children, and much less science. With each of the progressing trials, less science is done, less laboratory work is done on the samples, usually, not always, but usually, and more centers are involved in order to get the larger number of people. And phase 3 trials are thousands or sometimes even tens of thousands of people, because rare safety events, which is what you need to pick up, particularly for a vaccine, have to be, You have to look in a lot of people. And then the last phase, which is sometimes called phase 4, but is technically post-marketing. So after the drug or vaccine is approved by the FDA for sale, the drug company or the vaccine company is still obliged to keep track of any untoward events and the safety to report back. Because as you get into larger and larger groups, that's when you pick up a safety signal. And one of the challenges with a vaccine is you're giving it to normal, otherwise normal, healthy people. So if you're developing a cancer drug, your willingness to tolerate level of side effects is much higher than if you're giving a vaccine to normal, healthy children.
But you know, Sarah, there seems to be a race, a rat race, a competition between the various pharmaceutical companies in the United States, but also, Russia is claiming already a vaccine. China is. So how will physicians actually make up their mind which particular vaccine would be most appropriate?
Well, it's not actually going to be up to physicians in the first instance. It's going to be up to the regulators. And one of the things that's, I think, not so appreciated by people outside of the sphere in which I work is how important and how committed the regulatory authorities in this country and in Europe and probably every place else are. People think of them as perhaps obstructionist, but in my 30 years of developing vaccines and immune therapies, that's not been my experience. The FDA is staffed with really expert regulatory scientists, people who have clinical backgrounds, laboratory backgrounds, who are very committed to getting these vaccines safely to our population. And so they're going to look, they have sort of, to say perfect vision is overstating it, but each company can only look at their own portfolio, but the FDA sees everything. And they're very discreet and they won't tell you about anybody else's, but they'll know. So things will move forward in large measure based on what they see. And so there are two things any vaccine has to do. And this is the same really for a drug, is it has to be efficacious. So there's efficacy and there's safety. But safety always comes first, especially with
speaking about vaccine, this is a time when we prepare for the flu season. You think it's advisable to take a flu shot at this point?
It is always advisable, in my humble opinion, to take the flu shot. Now, the flu shot doesn't always work as well as we would like it to because flu changes so much. We're fortunate that coronavirus doesn't change so much. Mm-hmm. But this year, more than ever, it's absolutely essential, excuse me, that everybody get their flu shot.
So it's not a counterindication in terms
Not
of
at all.
Not at all.
The opposite. All of the health authorities are worried about the normal flu season intersecting with COVID. And we don't have a vaccine for COVID, but we have one for flu. Excuse me just a moment.
That's all right.
Piece of pepper got in my throat. Sorry.
Now, since our last conversation in April, and those were horrible times, particularly for New York City.
Horrible times, Rabbi.
Somehow we've made progress, both in the development of vaccine and so forth. How far have we gotten since the low point?
So we talked, I think it was May 5th. And May 5th was marked still dark days. So there's progress on a lot of fronts. I mean, we were talking, there's huge progress on the vaccines, more expeditious progress than, frankly, I even imagined possible. There are 4 really good vaccine candidates in human clinical trials on which data has been released and published. And they look as though they're inducing a good immune response in people. They're appearing to be safe in the small numbers in which they've already been tested, which is the most important thing, as I mentioned. So that's hugely important. But what may even be more important, and I guess it doesn't really matter which is more important, but we've succeeded in bending the curve. So we didn't overwhelm our health system. And people, the infection rate today, according to the governor, in New York is 0.79%. That means of the people tested, less than 1 in 100 were positive. And people who are tested are people who have reason to be tested primarily. So, I've seen different extrapolations, but that means probably 1 in several thousand of people who you actually see on the street are actually infected. That's in comparison to 1 in 20 in the worst days of April. And
There's a lot of talk, I'm sorry for interjecting, there's a lot of talk about building up immunity.
Right, but let me, before we get to immunity, which is my favorite subject in all the world, other than my son Jacob, and the reason we've been successful, I think, or one of the reasons, is the understanding of the general population of the importance of wearing masks and keeping social distance. I cannot, of all of the messages that I'm going to deliver, I hope, this evening with our community, I cannot emphasize enough how important the wearing of masks is. And unfortunately, our public health authorities didn't understand this at the beginning. So the messaging wasn't clear in the beginning. In the beginning, they said masks only protect you from infecting other people, and they're only important for healthcare workers. And that simply isn't the case. Now we know that the virus hangs around in the air, and the primary mode of spread is through the air, aerosols. And masks work really well at preventing both spreading it to somebody else and you getting it. And they work in several ways. They work both probably from preventing you from getting sick at all. But if you get sick, you get probably a lower dose of the virus and you therefore get less sick. And that with this virus seems to be particularly important. So one of the challenges we face now is being lulled into a false sense of security and feeling, as this isn't my term, but I love it, is COVID fatigue. I mean, I am super tired of not having all of my children at my Shabbos dinner table. That's one of my greatest joys in life, and I want them here. They can't come. They're younger than I am. They're out in the world. It's inside. I can see them outside. Outside is great. Outside really seems to be protective. And if you wear masks and you're outside and you keep social distance, even if you encounter somebody who's infected, you really are likely to be protected. And that's good news.
Are you suggesting wearing a mask even in your own home?
Well, we discussed this. Sometimes, yes, sure. So if you are with the people with whom you've been quarantined, you know, my husband and I sleep in the same bed. We brush our teeth together. I don't need to wear a mask around him because if he gets, you know, we're already a pod, as they say.
That's what I call a happy marriage.
Right, it is. We're very lucky. But if, for instance, a housekeeper comes in who would have been here usually, she wears a mask, and if she's in the house, I wear a mask. I open the window before she comes, I wear a mask, and she wears a mask. If a friend of mine comes, a friend of mine came over for a cup of tea this afternoon because it was raining. We were going to meet outside. She came in with her mask. I had my mask. We were socially distanced. I had the windows cracked, even though it was raining, and we kept really far apart. But we didn't take our masks off, and we didn't have our tea. And I think that that's absolutely essential. And this is one of the real challenges as it gets colder out, because I think being outside and the warm weather has helped us, you know, being able to outside because it's warm has made it so much easier. But as the fall rolls in, we're going to have to wear masks inside more. And I think that that's absolutely important. And Dr. Deborah Birx has recommended, both in the press and in a press conference, that in, you know, particularly like in Texas, where there are multi-generational households of people living very close together, they've noted that there's spread within homes. And she's recommending for those people that those people wear masks in their homes. It's not pleasant, but it's not impossible.
Like anything else in the United States, we're very much commercially oriented. So you recommend a Ralph Lauren or
no
LVMH or what
kind
of mask are you talking about?
There are all kinds of beautiful masks, but there have been, you know, I'm forever discussing with a variety of people in my life which are the best masks. So an N95 mask is a mask that is certified to filter out 95% of the particles. Those are the best. Those are reserved for healthcare workers. There are KN95 masks, which are supposedly the same, but they're made in China and haven't been inspected to the same level. So those, in all that literature I've read, those are the best masks. And frankly, that's what my family and I wear. They're readily available at pharmacies all over our neighborhood. And the thing that isn't made so clear, and I think this is super important, they can be reused. They were originally designed for single use, but in the hospitals, they, back in May, they learned that they could be reused. People were given one for a week, and as long as they're not wet, so they have to be dried. So you can dry them in a paper bag. You can dry them on a hook. There are a bunch of different ways. But those, I see all the pretty masks, and as much as I would like to wear one that matches my dress, like I see people on television, I'm wearing an N95, and I would suggest you do too.
So do you have a special mask for Shabbat?
Nope.
No?
I'll show you my mask. I have it in my pocket at all times.
Why don't you demonstrate? Oh, you're using that one. Yeah.
That's the one I'm using.
Yeah.
Now, I'll show you something else. I have this already. You set me up and we didn't even talk about it. So I just read an article today. This is the kind I like that goes over my ears, but it doesn't create as good a fit as this kind that goes over my head. So this kind with the over the head, you can feel it. It's strapped on better and it creates a better seal. So if you can get the ones with straps over the head, I'd recommend it.
So you don't recommend the mask for every different occasion, for formal?
But I saw advertised. So look, the other masks work well too. The things that don't work are bandanas and the buffs. The buffs don't work. The bandanas don't work. They work a little bit, but not well enough. 3-layered fabric masks, particularly made of tightly woven cotton, work almost as well as these, and they can be washed and reused. And if you don't happen to have these, or your pharmacy doesn't carry them, unless you're in the hospital, which that's a whole other matter, the 3-layered cotton masks are really good. What I wouldn't do is some of the masks have a respirator on them, like a little button.
Yeah.
Seen that? I have one here, but I didn't bring it. Don't wear those, because those protect you, but they allow you to breathe out whatever you're breathing. And so one of the beauties of the mask is it not only protects you, but it protects those around you. So it's really an act of chesed to wear it, to protect, to make sense, to protect yourself, but also to protect all those you might encounter. So I had some of the masks with the respirator on them, and I really found them a little bit more comfortable because they're more breathable. And then my husband brought it to my attention that, that they don't work as well. So I have now relegated them to a back pile. I'm not getting rid of anything because you never know, but these are the ones that I would recommend.
Thank you.
You're welcome.
That's not very good news for some of the major manufacturers of style.
But the 3-layered fabric ones are good too. And this is what I started to tell you, Rabbi. I saw something on the internet that some very creative young person had made a beaded mask cover. So it was very pretty for Shabbat, with sort of beaded long beads and round beads. It wasn't a mask because there were big holes in it, but you would put this on and then put the mask cover over it for a lovely effect for a party or Shabbat.
Now, another question, there was an extensive article about air conditioning.
Oh my golly, yes.
And can you elaborate on what is the best way to deal with air-conditioned homes, or those homes that have the unit or central air conditioning, plus and minus?
Okay, so Rabbi, let me first say, as I've told you when you first called me back in April after Pesach to discuss this, I really do like to stay in my lane. And I am an immunologist and a vaccine developer. I've spent my career doing those things. And my career has been pretty long, thank God. I am not an engineer, but I've been reading about it a little bit. So I will tell you the synopsis that I understand. And if there's somebody out there who's an engineer and wants to put in the chat, something different, please feel free. The best thing is being outside. And absent that, the very best thing is fresh air. So open your windows and open a door and get the fresh air in and the air inside out. That is remarkably protective. And I don't think I can overemphasize how good that is. Air conditioning systems vary tremendously. Some of them bring air in, some outside air. Many don't. Many just recool the air in the room. The ones that recool the air in the room are worse than nothing when it comes to COVID, because they're taking the air in the room and they're blowing it around. And in the blowing around air might be little particles. The ones that bring air in, there's variation as to how much air they bring in, and they may be a benefit. One thing you can do is put a box fan in your window, and that creates real movement of air, especially if you open a door or have cross ventilation. Whole building systems, that's a whole other talk for somebody with different expertise than me, but there's great variation in how much outdoor air they bring in and how that air is filtered. And there are things that can be done. HEPA filters are used in hospital settings and doctors' offices. Those are really good. I don't know that they're realistic for most residential settings, but then there are these MERV, MERV, and I don't even know what that stands for, but I gather MERV 13 is the thing you want on your filters. And I gather that changing the filters can make a very, very significant difference.
But you know, many of our neighbors and congregants too live in the co-ops and rental buildings where you cannot open a window.
I know.
So what should they move out?
No, I mean, look, first of all, if you're in your home with your family, it doesn't matter. There's no virus, you're presumably, or if there is virus, you're all exposed. There are these filters that can be added, the MERV filters and the HEPA filters. I would think that they would be a great help. And, I don't know what else to say about that. I do think that we're going to see a change in how things are built.
Yeah.
I've always been a big fan of open windows.
Well, recommend to your husband, Ellie Hirschfeld,
Yes,
who's very creative anyhow.
he's the one who figured out the box fans. He has a whole thing with the box fans that's really good, because the box fans really move the air, and moving the air is really, I think, the thing that you want to do. You want to get those particles to drop.
Let's talk about building up immunity.
Okay.
How do you build up immunity?
So that's the whole thing. So that's the whole story with the vaccines. And frankly, that's why this virus, because it's a new virus, is such a challenge. We all are blessed with an immune system that allows us to encounter something, and then the immune system remembers. So memory is the cornerstone of immunity, and the thing that those of us in immunology find so fascinating. There are wonderful examples of, for example, a epidemic of yellow fever that came through Norfolk, Virginia in these dates may be not exactly right, but say it came in 1890. And then there was no yellow fever in Norfolk, Virginia until 1937. And the people who had been alive in 1890, even if they hadn't had it, were largely protected. They hadn't been vaccinated, but simply by having been exposed to it, they had developed sufficient immunity that their immune systems remembered. Now, yellow fever is very, very good at inducing immunity for a whole bunch of reasons. So one of the reasons that this virus is so virulent and is spreading throughout the world, we have a pandemic, is nobody's immune to it. You see in flu epidemics, people who lived through an epidemic of the same subtype of flu, some large proportion of that age group of people will not get it. Immunity is established and you can make immunity to pathogens. Most of your immunity is to your own cells, and you're either immune or there's something called silence, which is an active silencing of the immune response, which allows us to tolerate our own bodies. You can be immune to pollen, that makes you allergic, or other, those people who are allergic to dander, that's also immunity of different sorts. But what we're looking for is a good protective immune response. So because this virus is new, lots of people are getting it. There is now some thinking that people may be at least partially immune based on infections with other coronaviruses. So about 25% of what we get that are called common colds are actually subtypes of coronavirus group A. And so there's just a lovely study published in Science, which is a preeminent scientific journal, showing that there were immune responses in blood of people that had been collected before the pandemic, long before, many years before, to SARS-CoV-2, the virus that we're dealing with now. So that means that that immunity was induced by a different virus, almost certainly a related coronavirus. So once somebody encounters the virus, they make an immune response. And the great question in immunology, and certainly with this virus, it looms very large, is why do some people get sick and some people don't? Clearly, many people are making an immune response and they don't get sick. And then many people are getting so sick that they don't make an immune response in time to save them. And the differences in those people are under active investigation by my colleagues. And there's all kinds of different reasons. Some are genetic, some have to do with the dose of the virus, some probably have to do with age, and some may have to do with all kinds of random factors that we don't even know about. And some have to do with pre-existing exposure to other coronaviruses. I hope that answered the question.
You know, you could have chosen any specialty. With your brilliant mind
Thank you,
and enthusiasm, what made you enter the field of pathology and particularly study of, viral? I mean, your clinical studies on HIV are really very well known.
Well, Rabbi, I would be delighted to tell you, and not to be self-promotional, but I actually have a moth story about this. So the moth is a radio program. So there's like a 20-minute story of how this happened. But I feel so fortunate because I feel like it was beshert, because it wasn't what I intended. When I was in high school, I got a summer job at the Rockefeller University for a young man named Ralph Steinman. I was 17, he was 34. He had just discovered a cell in the immune system called the dendritic cell, which is the cell that orchestrates all the other cells. It's the conductor of the immune orchestra. That's what he liked to call it. Most people didn't believe him, but I didn't know any better. And he was a wonderful teacher and a very kind man. And I found the work remarkably compelling. And in one way or another, I just kept working with him from the time I was 17. I went on to medical school. I did other training. Pathology was a discipline that allowed me to have boards and have a medical home and a university and kept me in the lab. And I have worked on, because the cell orchestrates immunity, I ended up working on vaccines, and there was a great need for an HIV vaccine. I started medical school in 1981, the year of the first case.
You want to hear my definition why you chose this field?
Sure.
Because you're a woman of faith. Because without faith, I don't think you would have entered that field.
Perhaps not. But the thing that I just want to mention is when I started to work for Ralph, people pulled me aside and they said, he's chasing an artifact. And an artifact is the worst thing in science. It's an artificial thing that you waste your time with. You're wasting your time. And in the end, he won the Nobel Prize. So, and founded a field of immunology, of which I'm a proud member. So I feel very fortunate to have stumbled upon this. But I do think faith had something to do with it. And I feel very fortunate.
I have to make a pitch for prayer. We are before Rosh Hashanah, and we're going to have this Saturday, we're starting Mevarchim HaChodesh for the month of Elul in preparation for the High Holy Days. And there's a lot of planning involved, not only for synagogues, but also for private homes. So first of all, a wonderful study. I know I'm sure you're familiar with it. Meditation helps in terms of your well-being, in terms of hypertension, heart, everything. It's better than yoga. Or you can reinforce it with yoga. But
I was just going to say they work hand in glove in my experience.
Okay, all right. So they go hand in hand. Okay.
They work hand in hand.
And I know that you pray every day, don't you?
Of course.
All right. So what are your 3 wishes from the Almighty for this coming year?
Oh, my 3 wishes are for health, health, and health. That's
and I give you my blessing, and I say amen, amen, amen.
You know, I must say, you know, I was reading an article about the effects of the pandemic on children, which is obviously of great concern to me as a mother. And this article was written by a very practical person who was both a psychologist and a mother. And it suggested speaking bluntly with your children about the pandemic and using the technique where you say, you know, what is the best part of this and what is the worst part of this? And so I did that with my son and my youngest son. My older boys we discussed in great detail. Just to say, the youngest of my older boys, my son Joseph Frankel, starts on Monday at Einstein Medical School as a first-year medical student. So I'm so proud of him. He is the fourth generation of our family to enter the profession, and he is entering at a time when it is absolutely clear that it is among the most important things one can do. And Jacob, my little boy, said, you know, he was really happy because he got to be at home. He didn't have to get up. He got to play more video games than he ever dreamed possible because I'm working and, you know, he's playing, you know, when he's not doing school, he's playing video games with his friends. And he was sad because he couldn't see his friends and he was sad for the people who were sick and had died. And then he asked me the same question. And, you know, I told him that I was happy because I got to be home with him. And also I get to sleep late, which I really do like. But I was also, what I didn't share with him was I was happy because it had really cast into sharp relief for me the importance of my work and the work of my colleagues and the work of my students and now the work of my son. And, you know, we who work for health, you know, it's never been clearer that that's super important. And it's not everything, but it's a necessary but not sufficient condition for a happy life. So I'm grateful for that gift of clarity, and I am praying for health and wishing for it and everything else I can do for it.
What have we learned? Now it's August, that we did not know about this virus and how to deal with it. Nothing like experience in life.
Right. And remember, we had no experience with this virus. It was a completely new phenomenon. So many of the missteps that people are very upset about, and anybody who's close to me has heard me go on and on and on about how upset I am about the missteps with masks, because masks work. You know, Ralph, who was my teacher, he was a wonderful teacher, not just to me, but in general, a wonderful public speaker. He'd say, you know, people can only come away with 3 messages in any talk. And then I was working with somebody who was a consultant at McKinsey, which is, you know, a very fancy consulting firm. And he said, people can only hear 3 messages in any presentation. So I figure if Ralph and McKinsey independently said something, it's got to be right. And if people can only come away with 1 message from this, it's wear a mask, because masks work tremendously well. They have bent the curve. We have gone from having, you know, literally 1 in 5 people who are being tested infected and people getting sick and dying. I mean, it's horrible, to an infection rate of under 1%. And, you know, I follow these rates neurotically. And there are now days when 1 or 2 people, which is obviously too much, but nothing like the hundreds of people who are dying every day. So the single thing we have learned that's most important for the public to know is masks.
You know, Luxembourg, small country, 2 million people, everyone in Luxembourg had a test. My question to you is, how often should one have these tests taken?
So the tests and the tests are super important, and testing is important in several ways. So you have to think, so let's talk about testing for the virus. And that's the test that typically is either a swab in the nose,
Correct.
Or it can be also a collection of saliva now, which is an easier collection method. So that test is useful for several things. It's useful if you're sick and you need to know the cause of your sickness. It's useful if you have been exposed and you need to know if you're infected and not sick. So this is another thing we've learned. 40% of people who test positive are asymptomatic. And that's one of the insidious features of this virus, because like Ebola, you get that virus and you feel dreadfully sick, so you don't go anywhere. Here, a lot of people aren't sick at all, or they're mildly ill. And that's when they're capable of spreading the virus the most. But the important thing is you have to think of it as test and trace. So if you are sick, if you find out you're positive, there's no medicine for this. It's not like a strep test where you get penicillin or another antibiotic, not always penicillin. It is a test that tells you you must stay home to protect other people. You must rest and take fluids and all of those things. But anybody who's had contact with you of greater than 15 minutes duration in the previous, I think it's 48 hours, needs to be alerted, and then they need to be tested, and then they need to quarantine. And this is the tried and true method that has stopped epidemics for the last 100 years. So it's testing and tracing linked together. And that's why the delay in the results of the testing is such a challenge. And one of the things that I'm really optimistic about looking forward to is the tests that are being used now are tests that have to be collected, the sample then sent to a lab, that has to be processed in a very complicated assay, and then the results reported. Colleagues of mine are working on tests that will soon be available that would be like a home pregnancy test. So, you'd spit on a stick and you'd get a strip, you get a line, yes or no. And if you're yes, well, then you have to stay home and everybody has to be quarantined. But if it was no, you would feel comfortable going to work and going to school. So the need to turn tests around faster and to have them more available is one of the things that we really have to focus on as a city-state country.
If I may be personal, how often have you been tested?
Me? I haven't been tested very much. I've been tested only once because I was asked to be tested at work, which was, I would be tested more, but I'm very, very careful in where I go. I haven't been exposed. I do every morning fill out an app from my work that assesses symptoms, that asks me if I've contacted anybody, if I've traveled to any of the states, or if I've had any of a long list of symptoms. And this brings me to another thing that is super important. And it really goes against sort of the culture of so many of the people in our community, me included. I have gone to work more times than I can tell you with a fever. I have soldiered on. I have sent children to school who weren't feeling 100%, and I had to go to work, and I'm like, let's give it a shot and see if you bounce back. That cannot happen this year. If you feel a tickle in your throat, if you start to sneeze, you owe it to everybody else to stay home. And that's when you need to get a test. If your kid is a little sick, they do not go out, they do not go to school, because that's what we have to do to protect the community. And that's a super important message. When you hear the public service messages, there's so many messages all together. So in addition to wearing your mask, don't go out when you're sick, stay home. Don't expose others. Get tested, and if you're negative, well, okay, then you could go out, but don't go out. And then if you're positive, stay home. And one of the other things is that I think is really unfortunate is that we have so controlled the epidemic here in New York City through tremendous effort and tremendous economic sacrifice. And if you look at the map of the states that from which people have to quarantine, it's a lot of states. It's really almost everything except the northeastern region and like 2 states in the upper Midwest, I think. If you are coming from one of those states, quarantine. It means you. Everybody has to do their part. It's one of those times when you have to sort of think of the greater good. It may be inconvenient and maybe you don't want to and maybe you feel fine. But I'm terribly worried that we're going to go back. I mean, we're never going to go back to what happened in March and April, but that things are really going to go backwards because of spread from other states.
That's why we have developed also with your help, guidelines attending services every morning, temperature testing, and questions asked, have you been in contact, and so forth.
Exactly. It's
and
probably
also,
questions that I have to fill out to go to work.
Yeah, and tracing.
Right.
Meaning if you attended service in the morning, 2 days later you got a call. Are you well? How do you feel? And so forth. Very important.
It's very important, and it's these old tried and true measures, until the more technological things come online, they actually work. And we have to, I mean, they're not pleasant. I was out, yes, I can't remember which day is which these days. One of the day it was very warm out, and I'm walking with the mask, and I could just feel it getting all warm underneath, and I'm thinking, oh, I want to take this thing off, and I didn't. But I'm shall I say, hyper aware of how important it is. The other thing, though, that's changed, and I just want to mention this as a note of reassurance to the community, is my colleagues who are taking care of people in the hospitals have learned a tremendous amount in the 6 months of the existence of this virus, or I guess it's 7 months now, whatever, since the beginning of the year. And the mortality rates, the number of people who are dying have gone down. It's still a lethal virus. There are still people dying. And if it's somebody you love, it's 100%. But there are treatments that have been approved. Remdesivir, which is a drug that had been developed for hepatitis C, actually works. It's an antiviral drug. There are many drugs like it that are being developed. Steroids, which have to be used very carefully in the later stages of disease, have been demonstrated. And these have been demonstrated in the kinds of clinical trials we were talking about in the beginning. They also work. There are more conservative measures. You might have read about something called proning, which is turning people on their tummies as opposed to lying on their back. And as counterintuitive as that seems to help tremendously. And I don't think, I'm quite sure, in fact, that there has never been a time when there's been so much communication and so much collaboration across, hospital systems, states, countries, to share best practices. So the kinds of things that were happening clinically in the early spring are just, we've moved past that. We've learned a lot, and that's something to be very grateful for.
So with the psalmist, we pray, Ana Hashem Hoshiana. God, save us, heal us.
Yes.
But then we also say, Ana Hashem Hatzlichana. And I interpret the second part, God, make sure that very gifted people like Sarah should be matzliach in your work and come up with some answers to a challenge that faces all of humanity. Okay?
Well, thank you, Rabbi. I've said this to you privately on the phone. We certainly always pray for the sick, and there's very little more comforting than the Mishberach. And we pray for the doctors and the nurses. But these days, we need to also be praying for the scientists, because science is going to save us. I mean, it already is. And that is a great comfort to me. And
we also pray for the teachers.
Yes.
Who are working overtime.
For sure.
Keep our children educated, even in these difficult days.
Right. And one of the things that I think is really important for people to understand is that this too shall pass. All epidemics end. Every one of them. The worst ones, and I'm a collector of books about epidemics, and we're not discussing it now, but at another time, if anybody's interested, I can go through a lot of them, as my family will allow, be happy to confirm. But this will pass. This will be over. And the key is to make it through. So as frustrating as remote learning was, and I say this as somebody who's not so technologically savvy, it was very hard on kids. It's very hard on parents. I think we have to be very sanguine about going back to school. And we have to be very careful. I think if there, people have to be, I think there have to be remote options for people who are immunocompromised. I think we have to support our teachers. We have to understand that this is going to be a school year like no other. And, there are going to be things that we're going to give up to protect ourselves and other members of our community that we're going to get back again. My mother, who I dearly love, who Rabbi, turned 84 this year.
She's young.
Oh, she's young and she's very vigorous. Let me tell you, she's
And
got.
you give her a lot of joy. Okay.
I certainly hope so. We give
Right.
each other a lot of joy.
Okay.
But we did a Zoom call for her birthday with my cousins and my siblings and everybody's children and grandchildren. And typically we would have had a big birthday party and all been together. And I said, it really brought tears to my eyes. I said, I'm so sad not to be together. I said, I'm planning such a good birthday party for her 85th. You guys it's going to be amazing. And I spend time focusing on that because this is really hard for everybody. I've picked out flowers and plants, and I'm not going to go too far because my mother's probably listening, but we have to focus that we're going to get through this together and it's going to be over. But between now and then, we have a lot of hard work to do and a lot of sacrificing. I mean, right now, many people know we have a big break fast. That is one of the great pleasures of my year, our life, my family's, and we're not going to have it this year. And I don't mean, it chokes me up to think about that. We're not going to have it this year, but God willing, next year, it's going to be even better. And I have to focus, and we all have to focus on, putting our heads down, getting through this very hard time, and doing the hard things we need to do to sacrifice so the virus doesn't come back here. You see these pictures of bars and parties out in wherever, and your heart goes out to young people. It's summer. Nobody wants to stay distant. Nobody wants to wear a mask, but it's what's required of us now. And so I just think that it's a kind of a balance to look forward to to what's, it's not that long. We're very fortunate. I mean, these vaccines are moving, it's just incredible to me how fast they're moving safely. I mean, the amount of effort, and one of the reasons that they're moving, and I would just like to point this out because I don't think this is clear. So you go through the preclinical phase 1, phase 2, phase 3, and then you market the vaccine, you have the vaccine. So when that happened for the polio vaccine, and I'm not old enough to remember the polio epidemics, but many people I love are, and they were pretty dreadful. There was this result that there was a vaccine that worked and there was no plan to make it. So it took almost a year and a half to go from knowing that we had a vaccine that worked to having one that could be distributed because nobody had planned for the manufacture and distribution. This is the first time in history that I know of that several vaccines are being made what's called at risk. So billions of dollars, our taxpayer dollars, have been invested to manufacture the most promising vaccines already. So if they work in January, February, whenever the phase 3 trials are going to read out, they're ready to go. So that's hugely comforting to me as well, because that whole other piece that we haven't spoken about of distribution, of, okay, you have a vaccine that works, how does everybody get it, is already being addressed. So, I'm hopeful that by Pesach, we'll be having a big Seder. And my mother's birthday's in April.
Let's focus first on Rosh Hashanah.
Okay. We're not having a big dinner for Rosh Hashanah, Rabbi.
And what about Sukkot?
No, sorry.
I want you to know I use the sukkah. We already built the sukkah.
Right. Sukkot is a little better because it's outside.
Outdoor office.
Right. Which good. I'm glad you're outdoors, but you still have to be socially distant, and we're still going to have to be really careful. It's not going to be a regular Sukkot this year. I'm sorry.
But my prayer again: be Matzliach, successful in your sacred work, and above all, I always say, let God grant us not what we ask for, what we need. What we need. And above all, we don't want to have this coming year the same as the year we leave behind.
No.
We want to have a healthy, peaceful, and blessed year for everyone and our families, and God willing, with men and women like you in the forefront. So when are you going to invite us for your next honor?
Whenever you want. It's not like I'm going anyplace. I'm here.
Anyhow,
I got an email from your secretary saying, when are you available? And I laughed because, when am I available? Pretty much any night you like.
Anyhow, really blessings to you, Ellie, and you're a wonderful young man.
Thank you.
and we will see each other either Zoom,
Right.
but we will be consulting with you way before the holidays.
Well, I have a call with many of your colleagues on Monday, so we'll be consulting on Monday. And Rabbi, our best to you and Mrs. Schneier. You know, she's in our prayers for speedy recovery. You know, we think of you.
And tell your beloved mother that I have her in my prayers. And she's doing well.
She's doing great.
Fantastic. Okay. So Shana Tova and all the best. Thank you for joining.
And Shabbat Shalom.
Shabbat Shalom. Thank you.
Okay.